Hello and welcome to my YouTube channel. Today I'll be speaking concerning a very important topic, which is why do healthy newborn babies die? Having a newborn baby is a thing of joy for any family, and it's really painful when a healthy baby dies. I'm not going to discuss all the reasons why a healthy baby born dies, but I'm going to pick up one particular reason why that could occur. And so, if you know someone that is pregnant, you're pregnant, or diabetic, or know someone that is diabetic, it's important that you pass this across to them. If a mother is diabetic or is diagnosed with gestational diabetes, in other words, you've got diabetes, it's important that the sugar level is adequately controlled. If that doesn't occur, the tendency is that you could give birth to a baby that is very large or very big for size, called a macrosomic baby. A baby weighing 4 kg or 4.5 kg or more. In the course of pregnancy, there is a bridge between the mother and the baby, which is the placenta. That channel allows the maternal glucose, that's the mommy's glucose, to be passed into the baby. So, because mommy's glucose is not adequately controlled, baby's glucose is also not adequately controlled because the placenta is there. And so the baby's glucose level, because it is high, the pancreas goes into a state of overstimulation and so produces increased amount of insulin. The problem occurs at birth where the umbilical cord is clamped, placenta is removed, the channel is removed, and so mommy's glucose is no longer available to the baby, and so there is an imbalance between mommy's glucose, the baby's glucose, and insulin production. Now, because the baby's glucose has reduced, the body doesn't know that, but continues to have a large amount of insulin in circulation, and so the blood glucose dips into what is called hypoglycemia. Hypoglycemia simply means low blood glucose. And so the baby begins to manifest certain symptoms such as shakiness, the baby becomes somewhat bluish, becomes unduly cold, what we call hypothermia, may actually stop breathing, baby becomes floppy, and then you observe that the baby is not particularly interested in feeding. If care is not taken, it could progress to seizures and the baby could die. How do we prevent this? Number one, it's important that you, as a woman that is pregnant, undergo antenatal care. It is at this time that it will be diagnosed if you are not previously known to be diabetic, whether you have hyperglycemia, which is raised blood glucose in circulation, and then your glucose level will be adequately controlled. When this happens, there will be less likelihood of you developing or giving birth to a macrosomic baby, and so this problem we're discussing will not or should not arise. Other things that will be done in terms of treatment will be early breastfeeding, and if for any reason you observe that the baby is not particularly interested in breastfeeding, that should give you a clue that something could be wrong. And then what the doctors will do once they identify that the baby has low glucose level, they will give glucose. This will prevent a needless death. I hope you've learned something. Please do subscribe. Thank you and see you again.